Milestone in the COVID-19 pandemic, but this one no one wanted to reach. The death toll now exceeds 4 million people worldwide. And to put that in perspective, imagine more than 66% of Metro Atlanta's population gone. Deaths in the U.S., Brazil, India, Russia, and Mexico make up 50% of that staggering number. The new, more contagious Delta variant is raising concerns right now, and many parts of the world are struggling to get vaccination rates where they need to be. Meanwhile, a CDC advisory panel will meet next week to discuss reports of heart inflammation in several hundred younger adults and teens after they received the COVID-19 vaccine. Now, in all, about 20 million teens and young adults have been vaccinated in the U.S. Fox Medical Team's Beth Galvin joins us to talk more about this. Beth, good morning.
And good morning, Elise. This was something that the CDC director, Dr. Rochelle Walensky, talked about in a media call yesterday. She said that they have had just over 300 reported cases of inflammation of the heart, known as myocarditis or pericarditis. That's inflammation of the heart muscle or the lining around the heart muscle. And this is something that they commonly see, Elise, after someone has a viral infection. In this case, they're seeing it in mostly young male teenagers or young adults who have been vaccinated with the mRNA vaccines, so the Pfizer vaccines or the Moderna vaccines. And they're typically seeing this complication after their second dose of the vaccine, typically within a few days of that second dose. So maybe about 3 or 4 days of that second dose.
Okay, so how serious, Beth, were these cases, and what kind of symptoms, are there any more that you can mention that young people have been experiencing?
So they're tracking this issue, and they're saying that Dr. Walensky saying most of the cases that they have had reported to the CDC through their vaccine adverse effects reporting system were not serious. So the young men, typically young men, responded to care well and fully recovered. There have been some who have needed medication to help stabilize their heart and get them through this. Some of them have been hospitalized. The CDC is really telling parents to look for a few symptoms of this heart inflammation. So chest pain, shortness of breath. You may have an experience where it feels like your heart's beating too fast, or it's fluttering, or it's racing too quickly. And it can be difficult to exercise when you need to exercise. So we're talking about, typically seeing this in healthier teenagers and young adults. So they're telling parents, if you're seeing any of these symptoms, get medical care, especially if if you're seeing them within a week of your teenager or young adult being vaccinated. And they're also asking pediatricians and doctors to kind of be on the alert for this issue and to ask young people coming in, hey, have you been vaccinated? Have you had that second dose within the last week? And then report that. Elise?
So CDC Director Dr. Rochelle Walensky, Beth, has said yesterday that vaccines are safe. She said all 3 of her kids have been vaccinated. So what is the agency telling parents of teenagers?
They are basically encouraging everyone who is age 12 or older who is eligible to get the COVID-19 vaccine to go ahead and get vaccinated. And the reason for that, Elise, is they are weighing the potential risks of this, what appears to be a very rare complication in some people. If we talk about, you mentioned 300 million younger people vaccinated. We have about 300 cases, or a little over 300 cases of this heart issue that have been reported so far in the last month. And they're saying that, there are a lot of really known risks that come with COVID-19 if you get this virus. And it can land you in the hospital. It's typically rare that we see severe complications in young people, but it does happen. And another real concern is that what we call that long COVID. And that is people that recover from an initial infection and then go on to suffer, from complications for months down the road, difficulty catching their breath, difficulty getting back to normal. So this is not an infection that you want to shrug off, and it is something that they're saying, they absolutely need to get as many teenagers as possible protected, Elise. And we're going to report more on what the advisory committee says next week when they meet to talk about the risks and the benefits when we talk about this heart inflammation.
We look forward to hearing about that. Beth, is all